Excellent. I appreciate that. Thank you very much. When John Bell picked me up this morning, the first thing he said to me is, "Are you a bow tie guy?" Because obviously our key speaker this afternoon, I think, or this morning, I know you're all here to hear, is also a bow tie guy. But I am definitely a bow tie guy myself. My younger son, Ryan, was a bow tie guy. And so he had me learn how to tie a bow tie, many YouTube videos, lots of carpal tunnel syndrome, lots of stress and strain. But the best part of a bow tie is then pulling it at the end. So I'm definitely a bow tie guy too, and this is one of Ryan's ties. So I am honored to wear it, and also to honor Ernie as well with that. So good morning. I'm very thrilled to be here this morning, to be with you all, to meet so many different people, and also just to be part of the energy that is building now for Lifehouse Atlanta. I'd like to start off thanking Kathleen Fleiser, John Bell, and the Lifehouse board for inviting me here from Arizona today. Thrilled to be here. Over the next few minutes, what I'd like to do is share with you a bit about the past, present, and future of how these programs are building and why it's so important to get you all engaged in this. I have a little clicker here, so we'll make sure we're going forward. So I know this very personally, as Katie just mentioned. My story is very similar to the Reed family and to other families that your Lifehouse Atlanta program is going to be serving. I'd like to introduce you to an amazing young man, my son Ryan. That's him with his older brother, who's also amazing. We're an Arizona family, but 20 years ago, we happened to be living in London, England for my job at the time. We were on an expat assignment for 3 years in London. This photo was taken 2 weeks before we were told by doctors that Ryan had a life-limiting disease called spinal muscular atrophy, or SMA. Take him home and love him, and don't expect him to survive to his second birthday. So our world was shattered. Devastated with this news and 11 hours away from the closest family member, all back in Arizona, we ultimately began receiving family support from a place called Helen House in Oxford, England, that was coincidentally only 45 minutes away. This photo on the right was taken a few months before Ryan died in December of 2018, and he was 17 years old. So Ryan was incredibly bright and mature, but very physically challenged. Spinal rod surgeries, hip surgeries, tons of physical therapy, respiratory breathing machines, a power wheelchair for mobility, and many emergency room and hospital stays. Ryan needed an adult caregiver for all of his daily living needs, for eating, toileting, bathing, and even rolling over to sleep and change positions when he slept at night. So our family, we kept a baby monitor in his room so that we could hear him cry out when he became uncomfortable. And either my wife or I would walk down the hall and either flip him to his side or onto his back. And that happened 2 to 3 times a night, every single night for his entire 17-year life. And that was when he was healthy. We trained ourselves to be very light sleepers, never allowing ourselves to fall into a deep sleep. We were always on guard. If Ryan was sick, a cold or the flu, which he would get more often than a typical child, those nights became even more intense. Ryan's body didn't have the strength for a good cough, and we needed to add nebulizer treatments every 45 minutes to an hour throughout the day and throughout the night. We put a blow-up mattress in his bedside for my wife, and she would sleep in his room for a couple of nights, and then after that, I would tag team, and I'd be now taking over for a couple of nights so that she could get caught up on some sleep, and I'd become the zombie. It took Ryan a long time to shake a cold, and so those nights were brutal. This became our normal routine for 17 years. His life was awesome, but it was way, way, way too short. Thankfully, there are very few children living with complex medical conditions, but now that you've heard about my family, perhaps that triggers you to think about someone close to you that has a child on a similar journey, maybe even within your immediate family or extended family. Oops. Sorry, we're going a little too fast here. All right. So a question that all new parents are asked, is your baby sleeping through the night yet? So that typically happens when a child reaches about 6 months old. Parents can finally get some much needed sleep. Now imagine that this does not stop. For a family whose child has a pediatric cancer or a neuromuscular condition or some other rare disease, the extra caring is multiplied and continuous. Day after day and week after week, it gets harder as the disease progresses. Medical advancements are keeping children alive longer, which that's fantastic, but that also extends the caregiving needs from parents. So remember, my son was not expected to live to 2, and he lived to 17. How do parents of children with medical complexities get a short break? These journeys are exhausting, stressful, and constant. That's why over 90% of these families typically end in divorce. So I can tell you personally that my wife and I were a phenomenal partnership devoted to Ryan's care needs. But I can also tell you that we were this close to divorce a number of times throughout our marriage. And thankfully, those opportunities really pulled us closer, and we've now been married for 31 years, so we've definitely beaten the odds. Respite is essential. It allows parents and family members some relief of caregiving responsibilities, an opportunity to sleep, regenerate their reserves, de-stress, and experience some sense of normalcy for just a brief period of time. Now, this requires trust, like the dad in the video said. Parents need to feel assured that their child will be safe, receive the appropriate care and monitoring, and have a good experience. So my family moved back to Arizona in 2002 to surround basically Ryan with family and love, not expecting him to live very long. The formation of Ryan House began basically a year later when my wife started passionately talking about our experiences at Helen House, and a community started to rally around her, including myself. We did not initially start out trying to do something like this, but it became clear very early on that the stars were starting to align and a community was starting to come together. At that moment in time, the U.S. had no such similar care facilities in existence. Our vision for Ryan House was to bring Helen House to Phoenix. Nothing more, but nothing less. Ryan House is a freestanding children's respite and hospice home focused exclusively on supporting families whose children have life-limiting conditions. So when I give tours and visitors are immediately wowed by the beautiful home and the specialty rooms, it's basically like Disneyland on steroids. But it's the world-class care team that really gives parents trust, knowing that their child will be cared for just like they would, so that they can finally get a short break and recharge. So my son loved the Beatles, and I remember one stay where Ryan was there for respite stay, and the team had connected with a local costume shop and gotten Sgt. Pepper outfits. So when my son came into the house that weekend, the whole team was in Sgt. Pepper's outfits. There were records hanging from the ceiling in the room that he was staying in, tie-dyed sheets on the walls. It was absolutely magical. My son also loved going to the Arizona State Fair. On another respite stay, the team used a deep fryer to recreate the fair food experience. So we're talking deep fried Oreos, pickles, ice cream. All the kids in the house that weekend it was very artery clogging, and they absolutely loved it. So the parents know that kids are going to have a great time here, which allows mom and dad to finally relax for a moment so that they can prepare to tackle the next challenge and the one after that. So my wife and I had a lot of community support and expertise helping us. We had no idea how to build a nonprofit. Ryan House opened in 2010, has served families with thousands of overnight respite stays since, and successfully raises over $3 million a year every single year to assure that parents are not charged anything for the services that they receive at Ryan House. Now that's a really tough thing to raise that kind of level of charitable support each year, which is why other communities really struggle to have something similar. A lot has changed in these 20 years, but Ryan House is a very proud legacy of this phenomenal young man. So I mentioned a place called Helen House, and this is where it all happened. In 1982, the very first freestanding dedicated children's respite and hospice home was opened in Oxford, England, just outside of London. Sister Frances offered to care for Helen so her parents could get a break. It was about friends and family helping friends and family, a simple model that really caught on. Over the last 40 years, the United Kingdom has expanded to over 54 of these kinds of children's care models, offering critical overnight respite and end-of-life hospice support to families with children on life-limiting journeys. Along the way, a national umbrella organization, Together for Short Lives, was created to bring together best practices, share information and insights, and provide that collaborative community of support to fuel this growth. It took 13 years for the very first dedicated children's respite home to launch in North America. In 1995, Canuck Place opened in Vancouver, Canada, modeled after the successes that the UK had been having. Today, our friends of the North have achieved 7 open homes. And similarly, a national umbrella organization was formed to achieve the same objectives of information sharing and building the collaborative community to stimulate this growth. It's called the Canadian Network of Palliative Care for Children. Another 9 years passed before the first home finally opened in the United States. Again, very much influenced after the work that was being done in the UK and in Canada. In 2004, George Mark Children's House opened its doors in San Leandro, California, which is a suburb of Oakland in the San Francisco Bay Area. So remember, when the Phoenix community started to rally around the idea of Ryan House, George Mark was not open yet. It took another 6 years for Ryan House to open and join George Mark as the second care model in the United States. So where are we today in the US? Well, our country is 5 times larger than the UK. So if we had the same penetration to our much larger population, we would already have 266 freestanding children's respite homes providing access to families on these journeys. But we don't. We have a handful. The US is significantly lagging. There is a tremendous unmet need for families across communities all over the United States, and we have lots of work to do to get this done. So why exactly are there so few of these homes in the United States? So first, the US healthcare system was primarily created to address adult care. So licensing for pediatric facilities like this are just very unclear. Life-limiting diseases are rarer for children than for adults. Children have very complex care needs as they grow up, and their life path is much more difficult to predict. Children are not little adults, but the current system just doesn't often see that. Second, homes require funding, and Medicaid and the reimbursement just doesn't cut it. Existing care homes run almost exclusively on charitable donations. Medicaid policies and primary insurance support can be improved, and we are committed in the long haul to make this happen. So I'd also like to make a quick clarification point that many people often will ask me right off the bat, is that I mentioned that the UK has 54 of these homes, and those that know about the UK know that there's a national health service there, the NHS. And so a lot of people will assume that the NHS is the group that really funds all of these homes in the UK, and that's not the case at all. In the UK, the NHS system, the government, supports adult hospice cares and adult programs at about 50% of their operation costs. But for the 54 children's programs, some of them get typically around 5% of their funding from the government. Maybe some of them get as much as 30%, but not anywhere close to all of their funding comes from the government. They have to do it the same way that we have to do it in the United States, which is primarily charitable donations. So addressing this gap is the end goal and vision of the National Center for Pediatric Palliative Care Homes. This is about capacity building in communities across the U.S. Like the UK and Canada, we've created an umbrella organization to help this. Your team and the Atlanta community are not alone in your quest to build Lifehouse Atlanta. First, we are building our national center efforts across 3 pillars of activity. The first thing we're doing is being a collective voice for education and awareness. By bringing more attention to these homes, we hope to gain a seat at the table for researchers, policymaking, and priority setting. Second, we're advocating for policy change. Our National Advisory Council is made up of all the senior-most leaders of all the existing homes, as well as representation from the emerging homes. With their guidance and the expertise of lawyers, parents, and Medicaid experts on our Government Affairs Council, we have a strong team to advocate for our cause. And then third, we directly foster the establishment of more community-based home programs. With the help of fellow champions and researchers of medically fragile children, we are confident that there will be hundreds of homes across the U.S. in the future. So the terms and the concepts that I'm sharing with you might be new and could be very complicated to understand, and they're unfamiliar to many people in the public, including policymakers that we need to advocate with. Therefore, what we're doing is we're choosing to emphasize our primary awareness campaign messaging around the recognition of a family's need for sleep and for overnight respite. It is the cornerstone service that all community-based home programs really strive to provide. We're excited about Children's Respite Homes of America as a visible and unifying brand across our participating home programs connected to our national center. This is the public-facing brand image for our social media campaigns like Facebook and Instagram. and for awareness, which is becoming our own fundraising mechanism to assure that the long-term National Center has sustainability. Similar to other successful national charities like St. Jude's, Shriners Hospital, Make-A-Wish, Habitat for Humanity, we're eager to begin engaging with corporate partners on a national level that basically individual community local programs just don't have an opportunity to participate with. Think McDonald's for Ronald McDonald House. We would love to get Home Depot involved, hint, hint. If anyone here can provide some introductions and open some doors, let's be sure to connect. So here's what the Children's Respite Home of America footprint looks like today. 20 years ago, when my family returned to the U.S. and Ryan House began to form, this map was empty, literally nothing. Today, there are 5 existing homes serving a handful of communities, with a pipeline of over 15 emerging programs with passionate leaders that have already secured their nonprofit status and have begun rallying their own communities. And Lifehouse Atlanta is on that map, and more to come. Take them home, love them, and don't expect to celebrate their 2nd birthday. Similar words are crushing to hear and forever burned into the memories of moms, dads, and families whose children are now on life-limited journeys. Disbelief, shock, denial. This can't be happening. How can I save my child? Mom and dad step up. Anything for their child. Passion gets sparked. Passion is fueled. Passion burns very bright. There has to be a better way. Families need help. So since our National Center social media campaigns, and we just had a big promotion launch event last week and webinar just a short time ago, that's already starting to help new passionate leaders emerge in communities that have never been part of our map so far. The list is already starting to grow. I wanted to share one such, and this is a little tight, so I'll kind of read it for you, but Lisa has already seen our Children's Respite Homes of America social media posts and recently reached out to us. She's from Tampa, St. Pete, Florida, a population of 3.2 million that also has almost 10,000 children who are medically fragile. There are no dedicated children's respite or palliative care homes in her area, or in Florida for that matter. Lisa writes, "Hi, I'm really interested on information and how to be more involved in our own community in order to found a pediatric hospice. I would love to talk to someone to gain more knowledge and direction and possibly mentorship. My name is Lisa Gonzalez. I currently live in Tampa, Florida, and I have a disabled daughter with a rare disease." Kate from Springfield, Massachusetts just reached out to us. Massachusetts has one of the more friendly Medicaid states and systems in the U.S., and they also have a political environment that is a lot more probably engaged for this kind of care model. Yet there are 0 dedicated community-based children's respite and palliative care programs in Massachusetts to support the 21,000 children and families that need it. Kate shared that their group has already begun forming and just became aware of what our National Center resources can do for them, and we already connected earlier this week. Here's what she said. "We share your passion and motivation to ensure children needs are being met across the palliative care spectrum." She and I were exchanging. "Thank you so much for the quick response and dates to meet." We met earlier. "Everything you mentioned resonates with me and our team. I attended your meeting on Thursday, our launch event, and feel ignited with motivation to power through this process. We are off to a minor start, and your coalition is exactly the kind of support we need." So I've been on many of these kind of calls and Zooms when passion emerges. These are the typical areas and questions that then come next. Is there any help on how to raise money? How can we see some of your business plans? How do we conduct a needs assessment for our community? How much is all this going to cost? How do we organize a capital campaign? Can we see your architectural plans? Which license should we use? The reimbursement rates are non-existent, so low. What's next? What type of people should we have on our board, and how do we manage them? Passion is the spark. It begins the winding long road to get a house open. Our National Center is organized around these programs to directly support community leaders on their journeys. Lifehouse Atlanta and our National Center have already been working together in these ways to help further the passion that you all already have. As you now have seen in action, our Children's Respite Homes of America awareness campaigns are starting to reach out to those passionate leaders in new communities. That's how we're going to find and connect with more leaders. We understand what fuels their dreams, and we can help. Our buddy system is about meeting people where they are. What have they already accomplished? What's already emerging as stumbling blocks? And then providing individual coaching and mentoring to them and their teams to support those initiatives and help them shape a long-term vision, to inspire them to know that this can be accomplished and they are not alone. Our Knowledge Center is about sharpening and growing the tool chest with best practices, templates, and support evidence to enable their efforts to be more efficient, faster, and stronger, and providing access to expert leaders that have successfully been in their shoes, who understand the healthcare system and how to navigate it. We create workshops with our Government Affairs Council to identify new opportunities and help strategize how to remove barriers. We also have 2 programs that are big picture and forward-thinking to impact real change in the U.S. healthcare system. One is our Seat at the Table, which is our collaboration efforts and connections with other like-minded pediatric health and palliative and hospice-centered organizations to bring our voice and energy to a greater agenda for policy change. And finally, our Raising the Bar is about developing accreditation and quality standards for these care models to assure consistently high quality care delivery for families, improve cost efficiencies, and increase overall outcomes. Our motto is building communities full of joy and care for medically fragile children. That's what drives us. So I bring all this back to Ryan. Ryan is my clear North Star. I know how needed this care is, and I'm determined to continue fighting for families like mine so that they can focus on spending precious time with their children. As I asked you when I first started speaking this morning, now that you've heard my story, it may have reminded you of someone close to your own family on a similar journey. We're all here this morning because of our connection to Kathleen, John, Mary, and beautiful Catherine, and the rest of the team at Lifehouse Atlanta. We either know them directly or know someone close to us that does and who invited us here this morning. So I'm connected with Lifehouse Atlanta from my heart. I know my son Ryan is just smiling and laughing at you all having to watch me right now. This is how communities rally together. This is how significant change is made. This is how children on life-limited journeys and their families in Atlanta, Georgia, will finally get the support they so desperately need along these journeys. This is how Lifehouse Atlanta gets built, opens its doors, and stays open. What an amazing legacy beautiful Catherine is helping to gift the Atlanta community. Bring your skills, get engaged, spread the word, and expand our community. Please give generously, and please be involved. Thank you, and I look forward to connecting all more with you and hearing from you.